Health nursing has helped me shape my whole life. A common question that I hear in interviews or just from my coworkers is, how have I stayed in home health nursing for so long? And why do I stay there? So I'm going to share that with you in this video today. My name is Charity. I've been a registered nurse for 25 years, and I've been in home health nursing 20 of those years. And today I just want to talk about why I got into home health nursing, why it's so important to me. And I'm just here to encourage other nurses to at least give it a try. You know, it's a different environment. It's a whole different world of nursing. And unfortunately, there's not a lot of education on it. Even when you go to the agencies, they don't provide a lot of education, and they expect for you to be an experienced nurse. So I just wanted to share my history with you all, since I will be sharing more on my home health journey. So, and as I was writing down all the positions and what I've done in the past 25 years, it just sent me back to memories, experiences, things I've seen for the first time. And I do believe having all this experience I'm going to share with you has led me to become a great home health nurse. I would say I have earned nursing awards in home health nursing, so I'm very proud to be a home health nurse. So I do want to say that I haven't done home health nursing straight for the 20 years. I've had full-time positions in home health. I've had PRN positions in home health, which I've always kept at. Even if I did have another full-time job, I always kept a PRN position in home health. So over the past 25 years, the things that I have done as a nurse, I first worked on med-surg. Then I worked in orthopedics. I worked on the neuro floor. I worked ICU step down. I was a float nurse. I worked on 23-hour observation, but then I became an assistant manager on 23-hour observation. Then I worked in the cath lab. I was a travel nurse for a minute. I did all of those before I became a home health nurse. I found out about home health nursing, and after that I included working at a rehab. I was a clinical manager at a home health agency. I was assistant DON at a SNF or inpatient rehab. I worked on a LTAC floor. Then I became the wound nurse on the LTAC floor, long-term acute care hospital. So that's my experience. And I've also come from a family of nurses. My mom's a nurse, and her two younger sisters are nurses. So it seems to me, no matter what I do, I've even stopped nursing and went into a whole nother career. It always come back to nurturing women, educating people, just sharing different life experiences, especially with home health nursing, because it gets such a bad rap sometimes. And it can be challenging now. It ain't all sugars and cream. It can be very challenging. But home health nursing has helped me shape my whole life, how I think about life, how I think about my family. It's helped me raise my two kids. I raised my two kids doing home health nursing. It's very flexible. I can manage my schedule. And I found out I use more of my skills in home health nursing than I did in any facility, that I did in any hospital. Because when you're a home health nurse, you are out there in that patient's home by yourself. So you have to have good critical thinking skills. You have to have confidence in those skills, and you have to know how to do a great assessment. That's why a lot of agencies want experienced nurses, because although you have your clinical manager that you can call on the phone, you are out in that patient's home by yourself most of the time. Sometimes a family member or caregiver won't even be present. So that's why I've been in home health nursing for so long, because it is a very autonomous job. You work independently when it comes down to your scheduling, managing your patients, orders, Just you're like the case manager of that patient, even if they have therapy in, you all work together for the care of that patient. But it has allowed me freedom to go to my children's basketball games, be available for them when they need me. If I need to go pick them up from school for illness or take them to a doctor's appointment, I was able to do that without having to use, PTO or make any kind of excuses of why I couldn't come to work that day. The patients are very understanding of that in home health. So it's been very good to me and my family. The downside, I would say the downside of it is going into people's home and not really knowing what to expect. Sometimes even if you've been seeing them for a while, each visit can be different. Life circumstances happen, family situations happen, and so you have to know how to self-regulate and be emotionally regulated in some of these homes that we have to go into. I just wrote some notes down just in case I didn't want to go out, too far off. So that's a little bit about me, why I stayed, and just the benefits that I have of becoming a home health nurse. I really believe that home health nursing has made me a better nurse. So if you are in home health and you're thinking about being a home health nurse, please follow me. I'll be sharing more things on all home health nursing. I have other videos, but this is one I'm just really gonna, hone in on. So if you are in home health nursing, thinking about becoming a nurse, thinking about doing home health nurses, let me know down below in the comments. What do you have a question or concern? What would you like to know? I'm here to share my experiences. I'm here to share, tips and tricks. And also I'm thinking about opening up a community for home health nursing, all things home health nursing. So thanks for joining me, and until next time, peace.